Okay, generally in Siaya County, we already have the health policy. And so I'm sure that there are other policies. We are working with the executive. We are working with other partners to bring up other policies that can support other areas in health. Currently, I know that there's a policy that is not a policy, sorry, a bill that is coming to the House on issue of community health workers. I know now it will be twacked to take up the new title of community health promoters, and now these are people who have to be trained. So they'll be retraining. There'll be a lot of other things that will be put into that policy, and that's one of the areas that I have talked to the directors of Kawabo. We need to. They need to come in very strongly and partner with the county government in the issue of training. Yeah, because it's something they're already doing. Yeah. Okay. Yeah. Yeah.
Very much. Kawibo is, it was a dream which was started just like a joke. We felt there was a gap which was required in health provision. And this gap was in the community, in the hospital, in schools, and even at the home of the old. We have people who are discharged from hospitals. They decide they go home with their treatment, they don't take care of those treatments. There are people who are sick. They have nobody to take care of them at all. So we felt, let us see how we can start this thing. And we formed a group of us. We're a group of health professions, and one of us is an administrator. So all of us who are health professionals, we have nutritionists, we have nurses, we have doctors, and we have an administrator, especially in health provision services. So we started it. It has been very heavy because everything that is started, you must use money. So we contributed until we got to about 400,000. Then we said we can now start by doing what? Training. Then we advertised. We've been looking for our students within reach of the people that we know. The first class we got was 9. One fell off because of school fee. Our school fee when we started was just 45. This 45,000 could not be managed, but we've struggled and struggled. Some of them we've decided to bridge for them. Some of them have managed to pay. So today, the class that we have here, we are 1 year old. Our class that is graduating is the first class. And we have people who want to come. But unfortunately, the people want to come, they want, but they cannot afford. We have to pay our lecturer. We have to pay rent, of course. We have to pay for other services within our offices because we need papers, we have to type things, we have to provide photocopy for our students, the notes. We have to transport them to their practical areas. Wherever we take them to dispensaries. We take them to the mission hospital like Rangala Mission Hospital, Sega Mission Hospital, St. Paul's. We take them for the home for the old. We take them to Mundeka Home for the Old. We were liaised with the sister in charge there. She allowed us to take our students. So that's why we agreed now we are going to be taking our students. So today, we are happy we have graduated our 8 students whom have been trained by the nurses to come and do those basic. They're not going to do the nursing services or nursing agenda. They're going to do the basic. And the basics that they're going to do is to make sure that the ward is clean the ward, the beddings are cleaned, the patients are cleaned, and the food, and then they'll be supporting patients in transportation from one department to another department. Our graduates will take care of patients from hospital at home. Our graduates will take care of the sick who are at home. Our graduates will help, like say you are the breadwinner in a home, and now you cannot take care of your mother, your father. You want to go and look for how to take care of them. So our graduates will bridge that gap by taking care of your sick at home, and you as you go looking for what to do. This is what we are doing. So our class that is graduating today, they are 8. 4 are already employed. 1 is in Nairobi, 1 is in Baragoi, 2 are in Migori. So the 4 are volunteering. But today, after graduation, someone told me that she needs one. So that means already the fifth one has already gotten employment. And now we have 3 left. So the 3 that are left, we have our liaison officer, who is Rachel. That is her responsibility. She's going to see what to do so that because all of us, the way we are here, each and every person has a responsibility. So I have mine, the way we are. Nerea is our principal. She's the one who takes care of the tutorial part of it. And also takes care, she's the one who is much more closer to the students as we do the running of the college. Some of us are around. Majority of us have retired. We have Rachel. Rachel is an international nurse. She transports patients from this country to another country. Maybe from Angola to US, from Rwanda to London, like that. So this is what she has been doing. She travels all over, taking care of those patients. So because she has done this, she also comes and mentors us and tells us this is what is required, and she also sees this outside the world. Now, as our plea or our cry, we feel this is a gap that should be included in the health services within the county because of the shortage of staff, so that the professional nurse can continue doing the technical part of nursing. These other activities that can be done, washing, cleaning, moving, all this ones can be done by this. A nurse cannot go study, do bachelors, get certificates, get diplomas to come and maybe carry the bedpans and do this type of things. These ones can be done by another level of people. So these are the people that we have trained to bridge that gap, so that the many patients and the few staff can be taken care of. So the qualified nurses in the hospital can do the technical, and the people we are training can do the basics. I think that's all.
But maybe a quick question. You didn't mention the title of the qualification that they are coming out with.
Yes, they are called healthcare assistants. The healthcare assistants, they can work anywhere providing health services within and diaspora. What the care that they are giving is a care that is international. They can take care of patients here in Kenya, in UK, and in the US. We have given them certificates. The certificates, the title of our certificate is called healthcare assistants, and we train them for 6 months.
Okay.
Yeah.
Maybe if you could summarize the same.
The law and already a county ka anti policies mangeny mag which thieth to masani mawangiyo maduong mogik nikech mana kaka waziri wacho ni wadwa wuok e curative, wadwa dok e thieth matimre kama wadakie, wan gi ler, wan gi chiemo maber, wan gi pi maler, mondo ji kik chop subtal. Ka chop kama ngato chopo subtal to koro en gima duong mosekalo piny ka. To jok ji aila ma wa graduate kawuono gi gine jok matimo tijego. Kuom mano kaka county assembly wabo riwre kodgi mondo gikonywa ka watieko loso draft mar policy cha mondo waso wach training be policy cha nikech sani ok wadwa community health volunteers, wadwa community health practitioners matieni gin joma nyalo tiyo, joma nigi tiegruok manyalo tiyo tich makare. Koro wabo makre kodgi, gikonywa gi wach, watiek draft policy no mondo kendo gikonywa gi kata wach training as partners in the county mondo wane ka wanyalo dhi kodgi e yo makare. Maduong moloyo gima daher wacho kapok watieko ka wawuok e wechego en ni mine nyalo dongi yie ni mine nyalo ka mine aboro gi nyalo chung kamoro achiel bagol nyithindo e gweng kech kamoro achiel mondo gimigi tiegruok, gitiyo gi pesa gi, gitiyo gi rieko gi. They are retired, they are here, they didn't just say now I'm retired, I want to rest, I want to do something to empower my community. For me, I'm really proud of them, and congratulations to them, and I think this is something that should be emulated across. Ka wanyalo yudo kata grube moko apare gwenge waka to mano gima nyalo golo siaka mantie bachop kama kare.
Thank you.
I'll take one of them and partially support.
Okay. In Dolu, a summary of what you have seen.
Ilungan Dr. Konyango, and he was in my health, and ka edugo kodu Nyawadwa, Mheshimiwa Cynthia, you can introduce yourself. And now wachoni kawuono nabiro after kose ora kod governor marwa James Agre Orengo no oran mondo abi iloye a preside over graduation tiegruok mar nyithiwa i organization miluongo ni Kawibo, Care Without Borders. To gima awacho en mana ni jomo qualify mokwongo chanro moket ka erigo en chanro maber mayawo yore mang'eny nyithindo mo qualify kawuono, to nikech nyithindo gi nyalo konyo jomoti, joma ok ngima, joman kod unfitness i dala kuma wadakie, ginyalo konyogi i mier i ute mwakane jomoti, old people's home, to be ginyalo konyo jotuo i ute mege chieth, medical facilities. En nafas maber, to en gima odonjo kendo riwore kod chanro mar sirkal maduong', to nikech sirkal maduong' sani olingo public health, to kod preventive health, to kod promotive health. Mamagi en wang'yo mayot mar duoko mzigo mar chieth, curative health care piny. Omiyo en gima ber, to kendo en empowering, medo teko kuom nyithindwa mondo gibed kod opportunity, nafas mar nwang'o tich. Waparo ni en gima ber, kendo wabo riwore kodgi kwa konyogi. Ka nitie nafas mar tich, to gibe ibo yiengi mondo gi apply, mondo gi compete kod jowadgi. Mokalo bonwang'o, to be oendelea mana gi tich mana kaka chano. Erokamano ahinya.
Erokamano.
My name is Priska Duro Muganda.
In the
Sorry. Nyinga iluongo ni Priska Duro Muganda. And I've been nurse for the last 35 years, and I said to you, by the time I natio hospital masrekal. Hospital masrekal kai kana tiyo ko tich to gap mananeno nikech natio kanyo naneno ni mai gima oremo wa makopo ni nyalo timre, to jatuo nyalo bet mamor, to nurse matiyo cha be nyalo bet mamor nikech tich ma nurse tiyo ng'eny. Makaro nurses gi gima ber ne gidhi somo, koduogo odwa yweyo ward, odwa luoko jatuo, odwa luoko linen make sure linen gi oluoki gi otim. To mai gik moko bode ko ber ng'ato dhi university somo duogo tim. Ng'at manyalo timo magi nyalo bedo jalwedo mana siso ni dhi om piende, dhi pedh, dhi luok, dhi ywe, mondo en otim tije ma dil gi dend jatuo. To nitie gima niluongo ni makindalo manatiyo kapok naweyo, nitie niluongo ni nursing process. Nursing process di jok manochake en Professor Miriam Mwagoro. Professor Miriam Mwagoro ne nowacho ni nursing ka ochakre osiptal to rumo e dala. Koro dala cha pok no rumi, to wan wadwa mondo watieke dala. Nikech wan karwa kae kaka ineno makane wan nurses machon. Wang'eyo kaka ne wadhi timo nursing nikech ne passion. To sani jomoko dhi nikech passion, jomoko dhi nikech en bridge mobro dhi godo Ulaya, jomoko dhi no dhi otem, jomoko dhi ni baba or mama owacho mro dhi otim. Opogore kaka ne watime chon cha. Koro sani gimomiyo gini wahero mondo watim mondo wa train students. Wadwaro mondo gidhi gikonyo osiptande wa mondo jowa mondo rit. Ginyalo tiyo kamoro amora, ginyalo tiyo e dala, ginyalo tiyo osiptal, ginyalo tiyo udi ma jodongo nitie, ute jodongo kamoketigie molornigie, giluokogi, gimiyogi chiemo, gigo kodgi mbaka, ginyalo tiyo e schools, ginyalo tiyo school health. Principal mora mora nyalo kawo gin nikech wasetrain gigo te. Ginyalo ng'eyo ni ma tuo machal nade. Sama in school, japuonj nyalo ore mondo escort students to the nearest facility. So that is why we felt that this thing is necessary. Kaka estiachwaka, wasebedo very unfortunate ni wasebedo kod gap. mar nurses osebedo kan chien. Nurses ineno jotuo gin 60, jotuo gin 40, to nurses samoro gin 2. Nurse ni dwa luoko jatuo, dwa dress tuon jatuo kidonda, dwa miyo jatuo chiemo, to dwa timo gimoro amora to gin jotuo 40. To nitie gik moko ma kata ng'at machielo moko timo technical part of nursing do timo. Emomiyo wafeel ni mondo koro nurse cha emomiyo kata ji wacho nurses ger, nurses en mana because of the pressure of the work magitimo. Emomiyo samo nurse nyalo duoki marach, wodo pong' to gik moko te pok otimo, ter monego bed notimogi. Koro ka oyude ng'ama nyalo giso ni dhi tim kama makonye, ubono ka nurses within this country change nikech koro there is support. Koro wan wawegi waparo ni our health services kata Ministry of Health, especially in Siaya County, because Siaya gin jowa, Siaya gin jogwa, jomane e Siaya ka indigo, gin nyithindwa, gin wegewa, gin mondwa, gin jodongwa. Kata wan wanyalo chako ni county wachini wa train ara jogi matimo tij lwedogi. To ma koro hospital obede kata kod ji 5 ma konyo nas timo gigo. Nikech idwa nongo nas achiel timo gik moko te. To nitie moko motimo mok do tim, ma jalwedo do timone. So nas onge gi jalwete. Koro jomwa train gi gin jolwet nurses. Erokamano.
Waya ne kami wacho ni 4 of them are already working. Gidolo.
Wasepuonjo mosenwang'o tiegruok ma otieko ma kawuono nwang'o certificate. Ne wadohogi mondo gibi gikaw certificate to nicha gisedhi. Achiel nyocha nwang'o tich Baragoi dispensary in Baragoi chantie kan Maralal. 2 tiyo Migori, nicha gisenwang'o tich Migori. Achiel nitie Nairobi. The 5th one asenwang'o employer. Koro wadong' gadek. Koro adek gi ema wacho ni mae to koro tich awene Recho biro neno kaka jogi nwang'o tijgi nikech kaka wan kani ng'ato nitie kod migape momako.
Ang'o minyalo kono nyathi moro ma samoro tieko form 4 ma pod parore no dhi osomo ang'o?
Okay, mokwongo wan jomwa train gin jo D and above. Nikech una CBC ni oyawo nwa wang' yo mar somo. Koro ng'ama osebiro kendego mwasepuonjo gik mitimo gi te wapuonjo gi maber kendo wapuonjo gi standard. Classroom mantie kacha gik moko mwapuonjo moko nitie board manyalo timo ma ginyalo neno. Koro wadwaro mondo ng'at mani obed notieko form 4 obed nen kod D katin nikech wadwaro mondo obi omed somo kodhi kod mbele. Somo sewacho ni ka indigo sani CBC oyawonwa ka india tekno bitimo gino maber inyalo dhi kod mbele. Ok wadwar ng'at man chien kabisa mok nyal tiyo nikech war qualify ji madwa dhi tiyo nyaka oko. Ogitiyo e Kenya ka to gitiyo nyaka Ulaya.
Thank you very much. That is correct. The approach of the national government is to approach healthcare in the way of preventive medicine, public health, and promotive medicine. And this area of health assistant, as has been stated, falls squarely under that area. So that is correct. They are close to the health, community health workers who are currently called community health promoters, and they are also very close to the nurse aides whom we have been training previously before. The county is very ready to support the idea. It's a very noble idea, and it opens up many channels, many ways for our youth. After capacity building them through the training that has been stated, from what you heard, they can go to the home, they can go to the aged people's homes, and they can go to refugee camps. They can also work in all our facilities. So they have a very multiple channels on which to work.
Will you be considering them for maybe contracts, or now that many of them, I believe, moving forward will be churned out of this particular institution?
The answer is yes. We do not discriminate. They are free. Whenever there are any opportunities which are advertised, they are free to apply. Our health department recruits very many cadres of workers. So based on the job opportunities advertised, they are free to apply, and if they qualify, we will support them.
Kindly summarize.
Before that, I heard you say that you are going to take one of them.
I think that one he meant training, supporting the training.
Okay.
Yeah.